Welcome to the D&D Fitness Radio podcast, brought to you by your hosts Don Saladino from New York City and Derek Hansen from Vancouver, Canada.
Dr. Komotar, how you doing, buddy?
What's up, dude? Everything good?
Everything good. I take it you guys met already?
Yeah, we were just talking about how he ate too much in Texas.
Yeah. I was just on the call with, do you know the company Lumen? Have you spoken to them yet?
The name sounds familiar. What is that?
It's the basically a macro device that you're gonna expel carbon dioxide into, and it's gonna let you know where you need to be on that given day. So it's just like educated carb cycling, but it's never gonna change your proteins. It pretty much promotes metabolic flexibility, and it's gonna tell you whether your carbs need to be high that day or your fats need to be high.
Wow.
I've been working with them now for 2 years. I'll send you one. Do you want one to try and
Yeah, that sounds super cool, man.
I'm making a note.
I'll email you my address. That's awesome. I would love to try that stuff out.
Yeah, it's good. And they're always looking for different thought leaders in the space. But I'm actually, there were some naysayers early on, and the research they have so much research on this now. It's two twin sisters. They were PhDs who were training for the Ironman. They were the co-founders of the product. And, the stats on it have been pretty incredible. I mean, if someone's actually following the device, the research has been pointing in the direction people are losing up to 12 pounds in 12 months. And
that's amazing.
Yeah, which is pretty good.
So it doesn't change your protein, your hydration. It's just strictly your carbs.
It's strictly carbs and fats. So what'll happen is it'll let you know. So it gives you a flex score. So rather than us, going on a scale and always, which listen, the scale can be valuable, as you know, but a lot of people are paying too close attention to it. In my opinion, I don't think they should be. They should be focusing on principles to become great. What I like about Lumen is Lumen doesn't really ask you to weigh in constantly. It's giving you a flex score based off of whether you're burning more fats or carbs, or carbs alone. So it's like all fats and carbs, or carbs.
That's awesome.
We're trying to get you to wake up in this fat burning state. We're trying to promote metabolic flexibility. So I've had I've been researching this for over 2 years now. I've had bodybuilders who are on strict protein diets come in, and it actually shows that they're utilizing protein as an energy source, which is obviously unnatural. It's not, we don't want that, right? So then what it starts doing is it starts directing you on where your macros need to be that day based off of your carbs and your fats.
Yeah.
So protein gives it a little low. They're not really at the gram per pound. They're at like 0.85, which I think they should bring that down a little bit. I think they should bring the fats get really high sometimes. But I worked on it for a while, and I got my flex score up to like a 19, like the top is like 21.
No, count me in. I'd love to try it out.
I think, and I'd love to get your opinion on it. But it's been, you start asking yourself the question now is like, well, is it the Lumen, or is it the fact that you're actually putting some structure into someone's life?
Exactly.
And that's where I'm at, because I've seen it work for almost everyone I put it on. There's always a case or two. But now I'm kind of like, all right, well, is it just the fact that they're structured, right? And someone who's not structured, suddenly they're consuming more vegetables, more fruits.
Yeah, it's all discipline. It's all discipline, which is kind of what we're going to talk about.
At the end of the day, it's pretty good. So thank you for coming on. That was my ramble, Derek. Good to see you, brother. Dr. Komotar, man, you're a fucking cool guy, man. I got to be honest. We had a good conversation last night.
Honest. Feeling is mutual. Feeling is mutual, man.
That's the only way I could say it. He's a fucking cool dude. Like we got on a great call a few weeks ago. We were back and forth. It was just a natural conversation. You just felt like you were talking to a normal dude that happens to be brilliant, Well,
I think we have a lot of the same passions, man. I've always been into health and fitness, and like anything else, you start learning, and a little bit of knowledge makes you more curious, and then you learn more and more and more. What I've gotten into recently is the cold plunge. That's awesome. That's good stuff, man. That really fires you up in the morning.
Oh my God.
But definitely something I wanted to talk to you about. Like, is that before workouts, after workouts? Like, I've read literature on you want to do it before, but then I've read stuff that says you don't want to do it before because it obviously reduces blood flow to your muscles. I don't know what your thoughts are on the cold plunge.
I feel like, and obviously you're the guest, I don't want you asking me questions here, but I'm going to answer this quick. I feel like there's so much research now pointing everything in a bad direction, right? Like I heard this recently with infrared saunas. Well, we don't want to do infrared saunas after workout. And you don't want to do cold plunges directly after workout. And they start talking about how inflammation is actually helpful. And we don't want to eliminate it. Are you eliminating inflammation or are you minimizing inflammation? I owned a cryotherapy chamber for 5 years at Drive, and I would have clients come in off of a red eye, no sleep, hungover, and I would throw them in a cryotherapy chamber. And then I'd say, listen, go take a shower, come out. I want you to bike or walk for 5 minutes on the treadmill, do some foam rolling. Let's do some stretching. And they're like awake. So most people look at me and be like, why are you getting them, into this state before training? I think you're actually getting them into somewhat of a sympathetic state when you're shocking them with cold. But I understand, like you're reducing inflammation, you're cooling the body down, you're making yourself a little bit more stiff before activity. The response I would receive from people who would go do that, I think, what would you call it? More from a physiological standpoint, more just like, right? Like they would just, okay, I'm here, I'm ready now. And it's suddenly, and we're still being careful about how we're pushing them throughout the workout. I'm not going in trying to hit max PRs here, but I don't know, man, we can get into this conversation. I just feel like research and research and research. And it's like, oh, for God's sakes, water's bad now. It's like, I'm not really, but like, I'm just saying, like, it's like, holy shit. Like everyone's trying to systematize something. Everyone's trying to turn around and sound like the smartest person in the room. That's what really drew me to you, is because everything is so simple. It's clean. It's palatable. You're way smarter than I am. Let's be very clear here. Like, I'm not sitting in a room with you like, what's he saying? And just being impressed that you're using terms that I don't understand. How did you get what drew you to get into the medical field? That's where I really want to start.
Yeah, sure. I've wanted to be a neurosurgeon since I was in 9th grade. I remember the exact day I was in like life science or something. I was in the back of the class, very average student. And the teacher mentioned something about brain surgery. And I remember being in the back of the class and being like, someone operates on people's brains for a living? I was like, that's the craziest and coolest thing at the same time. And I remember going up to her after class. Again, I'm in 9th grade, and I was like, look, I'm going to be a brain surgeon. And she was like, okay, just run along now, little boy, and we'll run along. And I literally, since 9th grade, I've never envisioned doing anything else. I just think that the job is so awesome. The privilege, the honor that people allow you to open up their heads and take out brain tumors, I think is something that I never get over. I've done close to 7,000 surgeries, and every time I see the brain, it's a little bit awe-inspiring, even to this point, because you're like, that's what makes that person breathe, talk, see, move, their emotions, everything is that gelatinous organ. And we know so little about it, which leaves so much room, for improvement. But honestly, I've always wanted to be a doctor, always wanted to be a neurosurgeon, always wanted to be a brain surgeon and do brain tumors. So it made the whole process easier. I mean, I think anyone would tell you that the earlier you know what you want to do, the easier it is. A lot of people don't know what they want to do till they're done with college or they're out a couple years, and that's fine. But the earlier you know what you want to do, the easier it makes the process. And I was lucky to just have that calling early.
How many years? So 7,000 surgeries over how many years?
10.
Wow. Key, you got anything?
That's a lot. I feel like I should have done more in my life. After hearing that, you obviously are on top of the research, but I have just anecdotally heard more about people having brain tumors, or and I don't know if it's just me being more aware, but is there something going on? Has there been an increase in your opinion?
I think that they're being discovered more. I don't think there's actually more. I feel like in this day and age, everyone gets an MRI if they stub their toe. People get a CT of their head if they have an itch on their arm. Like, it's such defensive medicine these days that people are ordering crazy amount of tests, which is a whole nother problem with the US health system, but we won't get into that. But it used to be that people would only get MRIs and CAT scans if there was a reason. Now, for any little bump or bruise, they get imaging of their head. So a lot of the patients I see have a brain tumor that needs nothing done. They're a young woman, they were in a car accident, or they're a young woman and they have migraines. They do an MRI of the brain, they find a 1 centimeter benign tumor, and then now we're stuck following it. And if that person was never in a car accident, they never would have had a CAT scan or an MRI, and they would have lived their whole life never knowing they had it. So I don't think there's more tumors per se. I think that as a profession, we're doing more scans for less indications, and that's leading to more tumors getting discovered that would have otherwise not been discovered.
Do you recommend a specific protocol to follow? Like, every year I'm going in for blood work. I also have a functional medicine doctor like Dr. Gabrielle Lyon, who's looking over my labs, and like I like to stay on it. And I was 40, turning 46. I just had a colonoscopy. They said that they lowered the age now from 50 to 45. Like, I like doing preventative things. I think I owe it to my family. I owe it to myself. Like you never know. But when it comes down to the brain, I mean, I know I'm not thinking like, how do I know if I have anything or not? Is there any type of protocol I need to go through, or that you would recommend people to go through to be safe?
So there's no set protocol. What I would say is I totally agree with everything you're saying. I think preventative medicine is definitely the way to go. Seeing your internal medicine doctor, your primary care, getting the labs, the colonoscopy, the A1C, all the standard stuff to prevent diabetes and colon cancer and heart disease, all of that I agree with. The brain is a little bit more of a black box, and I feel like that the concept of getting a screening MRI of the brain it's not a good idea. Similar to, why don't we get chest x-rays on everyone, right? Just screening for lung cancer. And that's come up too. And there's an article on Forbes that we published maybe like 10 years ago on this, but basically showing that, especially when it comes to the brain or lungs, screening ends up leading to more harm than good. And by that, I mean, if everyone gets a brain MRI, you're going to find inconsequential tumor or lesion or something that you never would have known about. You're going to see it. And now you have to follow that. So for example, if you do a chest x-ray, you may have a little opacity on your right apex of your lung that's been there since birth, nothing to do. But the doctor's like, well, I don't know what that is now. Now we saw it. Now we're kind of obliged to follow it. Maybe we want to do a biopsy. So now we biopsy this lesion. It causes a pneumothorax. You never should have gotten a chest x-ray without symptoms, because you're going to find stuff that you don't necessarily know what to do with. So, when it comes to the brain, I tell people you shouldn't just get a routine CAT scan, a routine MRI, unless you're having symptoms. Obviously, if something is off, you're having trouble with your speech, your vision, your language, your movement, by all means, see a neurologist and then get an MRI versus a CAT scan. But the idea of doing a screening brain image has been proven to actually cause more harm than good.
How about on the prevention side? I have a friend who they discovered acoustic neuroma, and so they're monitoring it. And they also found out he was going to go get surgery, but they prepped him and everything, and they found out he was diabetic. And I'm like, well, he's a track coach, so I'm like, what happened there? He's like, oh, I guess I just drink a lot of soda all the time. So once they modified his diet, things, normalized. But in the case of something like a brain tumor, are there things that people can do from a diet point of view to minimize growth or kind of keep things, from getting worse?
It's such an interesting topic. I think that when you're talking about any form of cancer, one of the hot topics is cancer as a metabolic disease. On my podcast, I interviewed a PhD from Boston College who is one of the leaders in this field, basically talking about how, we always consider cancer to be a mutation in the DNA, which leads to unregulated replication. The cells divide, they don't die, and then you have a tumor that grows. But the literature now is showing that actually it's not necessarily, that's not the starting point. The starting point is the diet and the metabolic disease and the increase in glucose and the insulin surges leading to inflammation. That causes more mutations, which leads to cancer. So very preliminary data, but brain cancer, similar to other forms of cancer, what the literature is pointing towards is that as everything else is, good diet, good nutrition, good sleep reduces inflammation, promotes health, and is theorized to reduce the incidence of cancer, including brain cancer. Doesn't mean that a candy bar is going to cause brain cancer, but in general, cancer is a metabolic disease, and what you eat influences not only the start of cancer, but how quickly it will propagate. So we're doing some studies looking at the ketogenic diet, and there is some data showing that if you reduce the amount of glucose and carbs and you go ketogenic, that you can starve these tumors out and slow their growth, which is really interesting.
I mean, it's fascinating, man. I heard Richard Perlmutter talking about that years ago. Is the research now becoming more conclusive, or was it not conclusive back then? Because I actually did hear some doctors speaking about it, but I was always afraid to comment on it because I couldn't get a direct answer on whether this was a discovery or just a hypothesis someone was forming.
Very hard to get good data on this. So there's very good animal data. The human data is hard, right? Because you're telling patients to go keto. You don't really know if they are going keto. It's hard to track. And then there's the correlation versus causation, right? So if someone is willing to go super strict and modify their diet, in general, that's someone who has discipline, who's focused, who's educated. They're going to take better care of themselves in general as a cancer patient, as opposed to someone who, look, I have no discipline. I'm going to have my sweets. I can't really regulate. Maybe I miss my chemotherapy appointment. And so is the metabolic component of the diet leading and causing better results? Or is it correlated that if the person's willing to be strict and disciplined, that in general is a better patient, they're more compliant and they're going to do better? So hard to get good data. The data is still very suspect, but I get patients that ask me all the time, doc, what do you think about the ketogenic diet? What do you think about eating vegetables? I always say, look, there's nothing conclusive. It can never hurt to eat healthy. It can never hurt to eat healthy. It may not stop your tumor, or it may, but eat healthy in general. You're going to have more energy. You're going to be more into it. It's going to help your body recover.
This becomes the challenge with most research, right? People will start pointing in a certain direction when we make specific changes that we know are going to be helpful, right? Like, was it, I will always revert back to that documentary, I think it was called Game Changers, when they were talking about doing a vegan diet, right? Vegetarian diet, basically giving up meat. And, when you take a bunch of firefighters that are drinking beers and eating Doritos, and then you turn around and you're like, no, you're done with that. We're going to give you, these are bean burgers, and we're going to give you fruits and vegetables, and we're going to take away the beers, and we're going to give you water. And they were like, well, in 2 weeks, all of these firefighters lost a combined, I'm making this number up, 88 pounds, whatever it was. No shit, right? But like, would they have done the same thing if we were using grass-fed beef, high quality animal proteins, eggs, fruits, vegetables, healthy grains? Like, is the research going to be much different? And what I'm finding out a lot of times is that it may not. It actually may point us in the direction of saying that having that animal protein might have been a bit better. Are you seeing this in your field, where there's a lot of research that you read years ago that now there's a lot of contradictions towards?
Yeah, absolutely. I think that in medicine is no different than like nutrition. And I think we spoke about this, Don, on my podcast, basically talking about how fats were terrible, then fats came back into favor, carbs are out of favor now, and that most likely in the near future, carbs are going to come back into favor. Same thing in medicine. People they'll jump on a bandwagon because their early data is promising. And then as the data gets fleshed out, they realize, okay, it's actually not that beneficial. And then it swings in the other direction. So I'm always leery, I'm sure just like you are, when it comes to kind of fitness topics, when someone's like, this is the golden bullet, this is the answer to everything, this will solve your problems. I'm always like, look, nothing's going to solve your problems. This is another key piece of advice that you need to integrate into your life. But there's not like there's not one simple thing that's going to make you healthy, that's going to get rid of brain tumors, that's going to get rid of your diabetes, that's going to make you lose weight. I think it's a general lifestyle. It's the way that you get up in the morning. It's the way that you view work, you view what you eat, you view what you work out, how you sleep. I think that you need to look at it holistically as opposed to looking for one simple solution. And that does not exist in medicine. It does not exist in fitness and nutrition. It
Right.
exists in very few things.
Right. D.
All right. So, food and nutrition. What about environmental factors? Like when I go to the dentist, they always want to x-ray my head. What about this? What about that? Or AirPods? Or when I go through security at the airport and they want me to, go on the thing and it goes around. Are those things I should be concerned about, or should I should try to curb?
Not concerned about. They've done a lot of studies, especially cell phones, because we're all attached to it now. No correlation between cell phones and the incidence of brain tumors. Simple x-rays like that. If you're getting x-rays every single day, that's one thing. But if you're getting a simple jaw x-ray once every 3 or 4 months for your teeth cleaning, going through the airport x-ray, flying on a plane at 30,000 feet is like 10 x-rays. So, at the end of the day, if you're going to be that cautious, overly cautious, then you can't even fly to Europe, because that's like, 50 x-rays that you just got right there flying over to Europe. So, you can't stop living your life. I think that none of those things have been proven to singularly cause cancer or lead to brain tumors. And they've done a lot of studies on it. So we currently don't, it's not like lung cancer where we know that smoking leads to lung cancer. We don't exactly know the causes of brain cancer, which makes it much more difficult.
Do you think, this is more of a general question, but do you think people are prioritizing a lot of the wrong things, right? Like you'll have, like you and I were talking about cold plunges. We love them, right? But then suddenly someone's, a researcher is like, well, you shouldn't do it after a workout. Well, you shouldn't be doing it before a workout. You should be waiting 3 hours later. Like who gives a shit? Like, honestly, like what percentage is it really going to improve your overall well-being? If it's cutting down on your inflammatory markers a little bit too much, where you can't recover too much, are we really worrying more about that? Are we really worrying more about the phytic acid in brown rice? Or should we be worrying about the fact that they're sleeping 4 or 5 hours a night? Are we focusing too much? Are you seeing, in general, people are focusing too much on the wrong things?
I think people not necessarily focus on the wrong things. I think people get too granular.
That's
like you were saying, they get stuck on these little details, this little minutia that at the end of the day, they don't make a difference in the general gestalt. So, living healthy, exercising, eating right, sleeping right, that's a mindset. That's the way you get up and you approach the day. If you have 5 grams too many carbs, that's not going to affect you. Or if you do your cold plunge, like we talked about, if we do it before the workout, after the workout, you do it for 3 minutes, 4 minutes, it's whatever works for you. It's not like, oh, well, Don does the cold plunge 4 minutes and Komotar does the cold plunge 3 minutes. Should I go to 4? Like, maybe I'm not ready for that 4. And so at the end of the day, like those little details, I tell my patients, at least, don't get bogged down in the details. You got to look at it holistically. You have to look at it at a 30,000 foot view as opposed to down in the weeds. Because if you get bogged down in the details, you end up getting lost in the forest for the trees, and you don't end up hitting your final goal. Like you're sitting there ruminating about how much protein you had, instead of, like, in general, just focusing on eating well or not going to sleep as early as you want to be. And so I always say it needs to be a much more global perspective as opposed to the minutia that people get caught up in.
I agree with that. D?
My mother had a stroke at the beginning of COVID and affected her left side of her brain, and so she's more speech that's affected. Everything else is pretty good, honestly, considering the scope of it. How important is it for people like that age? She's in her 80s to exercise the brain, so she's still doing a lot of therapeutic things with the iPad and all that and it's working. But how important is that now that we're concerned about things like dementia, Alzheimer's? What kind of brain exercises should people be continuing to do as they get older?
So there's no one exercise, although it has been proven that people that stay stimulated intellectually have a lower chance of dementia. So people who are alone tend to get dementia earlier than others. People who are not stimulated, meaning like they don't have interaction with other people, they're not in clubs, they don't have hobbies. So I definitely think that keeping humans and individuals intellectually stimulated as they get older, when they're no longer working, right? So they don't have that purpose in life. You get up and you have a purpose. You got to maintain that sense of purpose. The intellectual stimulation definitely has been shown to lead to less rates of neurocognitive decline. At the same time, the literature is coming out that, and we used to never know this 5 years ago, but healthy lifestyle, everything that we've talked about, working out, nutrition, sleeping well, it's not just the heart, it's not just the diabetes, not just your kidneys, it's also your brain. It's also your brain. There's a lower chance of cognitive decline, lower risk of Alzheimer's, lower risk of Parkinson's if you reduce inflammation and do everything that we've already talked about in terms of having a healthy lifestyle. So I think that, you know, your mom had a stroke. She definitely needs to get into neuro rehab, which is a whole separate field. But in general, even if you haven't had a stroke, as you get older, as people, you know, retire and don't have that sense of purpose, they somehow have to maintain that drive and that intellectual stimulation.
Can you, and I don't know if this is your wheelhouse, because this might even be more of a nutrition question, but are you able to discuss the correlation between gut health and the brain? Because I know that's been a question that a lot of people are sending our way. It seems like the research is becoming more and more valid, right? And a lot of functional medicine doctors like Dr. Gabrielle Lyon, Dr. Dwayne Jackson, they're pointing in the, like, no, absolutely, there is an absolute correlation between the two. What have you researched on it, or is that in your wheelhouse?
Yeah, that's not in my wheelhouse. I have heard, though, just from working in a hospital, obviously, and talking to other doctors, that the gut biome is absolutely critical. Other than maintaining that gut biome and the appropriate flora that leads to different metabolic diseases, I don't know exactly, but I know that that's a big focus of GI research. And I think we're going to find out that a lot of these chronic diseases, again, whether it's dementia, whether it's Alzheimer's, whether it's heart disease, whether it's diabetes, hypertension, these are all going to be related to inflammation in the body, and they're all going to have a metabolic source, and it's going to be very clear. I mean, also, if you look at, there's done research that like cancer is relatively rare in animals. Relatively, it's not super rare, but it is rarer than it is in humans. Why do humans have such a high rate of cancer, compared to other animals on this planet? And that's because we honestly don't live a healthy lifestyle in general, most of us. And that's what the literature is pointing towards, is that how you live your life doesn't just affect how you look. It also affects these chronic diseases that are devastating, and they're totally preventable. The literature shows that something like 70-80% of cancers can be prevented if people do lifestyle modifications, which is crazy. Think about that. 70-80% of cancers. I mean, it's the second leading cause of death in the world.
Right. Dave?
Another sort of out of the wheelhouse question. I work with a number of NFL and NHL teams, and obviously concussions always come up, and things like, obviously, the prevention side, better helmets. But even on the rehab side and recovery side, I still think, they're not sure, how quickly you bring somebody back. I remember watching one of the hockey games, a playoff game, somebody had a concussion. They're like, oh, when's he going to come back? And they have to go through concussion protocol. What are your thoughts on that side of it, and the implications of having, say, the Miami Dolphins quarterback come back too soon, and how's that going to affect the rest of his life?
What a black box, man. That's like it's such a hot topic, and we literally know nothing.
Yeah.
Anyone that tells you that they understand concussions is completely full of shit.
Yeah.
So I help cover the Dolphins. Our group here covers the Dolphins. We were all involved in that whole Tua situation. Hindsight's 2020. The only thing we know is that multiple concussions in a short period of time definitely compounds the effects. So, if someone has a concussion, you definitely want to hold them out, as opposed to in the 80s and 90s and early 2000s when it was smelling salts and then you were back in the game. So we know that the more time off, the better. When is someone ready? They literally do these neuropsych tests that are completely vague. There's minimal science behind it. They're like, oh, I think this dude is ready to go back in the game. At the end of the day, there's like such minimal science behind it. And there's no markers of inflammation. Like, it's one thing if someone has a heart attack, right? Someone has a heart attack, you can do blood tests to look at troponins. You can look at the EKG. You can do an echo to look at the heart, make sure that they're stable to get back into whatever activity that they want to get into. We have nothing with the brain. Like, you do an MRI of the brain, you don't see CTE on an MRI. There's no blood test currently that will show CTE. So my thoughts on it are that the NFL is doing as good a job as it possibly can on a topic that we literally know nothing about. And the research is growing, but it's growing slowly. And what's the right answer? Honestly, no one knows. I think that it's a very tough situation when you have someone like Tua, who's young, has an incredible passion for the game, has hundreds of millions of dollars ahead of him financially. And to ask him to stop playing, not that it's unreasonable, but I understand how difficult that is for someone to give up their passion on a theoretical risk. So it becomes very, very difficult to justify either stance of when to go back in the game versus when to hold out. What do I see happening in the next 5 to 10 years? I see the research coming up with objective measures as opposed to just subjective measures. You do a blood test or a certain test that says, okay, still has inflammation in the brain, cannot be hit again. Right now, it's all just a gestalt. So the answer to your question is we literally know nothing. I wish I had something more concrete.
No. I mean, I appreciate the honesty, because there's so many people now that are categorizing themselves as concussion experts. And I'm actually embarrassed. I don't even know the answer to this question. There probably is an answer here, but are there different grades of concussions? Is there like a grade 1, grade 2, grade 3? Are they categorizing them differently? Because I would imagine that, I hear them say, well, he had a minor concussion. I'm like, well, how do you determine between a minor concussion and I've had big time concussions where I've been knocked out cold and they found me in the snow, or knocked out cold and they pulled me out of the water. Right?
Yeah.
Just I can go on and on and on. And this is probably probably through the 90s. And I like to think that my head's here most of the time. But are there different categories of concussions? And if so, what are they?
So there's not really categories. When they talk about major and minor, I'm assuming they're talking about, did you lose consciousness?
Right.
So that's like the big differentiator. There's a lot of ways to diagnose concussion, which really becomes subjective. The one thing that is not subjective, that is understood, is that if you lose consciousness, that is a concussion. There's no arguing that. And that person comes out of the game. That's a severe concussion. The more mild ones are the ones where the person never loses consciousness. There's no neurological symptoms. They may complain of like a fogginess. If they do a neuropsych test, they're like a little bit below where they should be. That's technically a minor one, but there's not like a set grading system. I'm assuming the people who you're talking to are saying major concussion is, like you're saying, when they find you knocked out in the snow, that's a major concussion, versus someone who's boxing, gets a couple of hits to the head, and the next day they're like, I just don't feel right.
They got their head rattled, or maybe took a shot in a soccer game or football game, and they're, stumbling to get to their feet, type of thing, right?
Yeah. And if someone is having neurological issues, like they're stumbling, that's a concussion. That's once you have neurological symptoms, you're having trouble seeing, moving, hearing, speaking, that's a severe concussion. It's the more subtle neurological symptoms, like a little fuzziness, a little memory issue, headache. Those become much more difficult to make the call. And another interesting topic is the whole CTE topic, in terms of what is the downstream effects of these concussions. I interviewed Bennett Amalu. I don't know if you know the name, but he was the pathologist who first discovered CTE. He was remember the movie Concussion that had Will Smith in like 2016, I believe it was. That movie was based after him, but he was a neuropathologist who first discovered CTE. He coined the term and basically found it. And I interviewed him on my podcast, and he basically said, I said, what percentage of NFL players do you think will develop CTE? And he said 100%. It's just the different degrees. You know, you hear about the people who commit suicide or are involved in domestic violence or depression, but how many of these NFL players, when they hit 55, 60, can't balance their checkbooks, can't do their taxes, get angry, have fights with their spouse? You don't hear about these things. And those are subtle, those could be subtle CTE effects. And so I think a lot of the data is still forthcoming about the effects of chronic and repetitive head injury.
Have you heard much about any research related to neck strengthening and, you know, keeping the head from bouncing around and all that? I know I've seen more and more that. I was at the NFL Medical Summit last month, and they had all sorts of devices to like strengthen the neck. And I'm like, okay, I guess that counts. But what are your thoughts on that?
That's been shown to definitely help. If I were to ask you what sport is the leading cause of concussions in high school athletes, what would you say?
Somebody on the weekend said cheerleading that I was talking to.
That's pretty funny. No, it's women's soccer.
Oh,
Women's soccer, because they're constantly heading the ball,
yeah.
and their heads are basically the same size as males, roughly, but the neck muscles are weaker. And so female soccer players get concussions more than male soccer players, even though they're doing the exact same activity with heading the ball, because their neck muscles are weaker. And so I think neck strength definitely makes a difference. I know that's huge in the NFL. So yeah, I mean, the data points towards, you know, it's the whipping motion that the brain sloshes around in the skull that, you know, that has to be reduced. So the answer is, yeah, it definitely has an effect.
You know, there's certain information that whether you just question, are we ever going to receive the answers to, right? Like there's so many, I mean, we've evolved so much as a society, right? I mean, even technology has been amazing and research has been evolving, and we've been just continuing to find out more and more about things. But there's other categories that I still think, you know, we're in the dark about, right? Like you're hearing all this talk about cannabis now, right? And, you know, it's not my field. I don't truly understand. I'm hearing about things that it can help improve, but we don't really know, right? Like it's even like within the supplementing market, when you start looking at specific amino acids, they work, they don't work. Well, are we ever going to find out if they truly work, or if there may be, you know, is it a placebo effect? I do believe certain supplements do work, but we're prioritizing that over nutrition, which shouldn't be. Like someone came to me once and they said, I started taking L-glutamine. It is the best amino acid I've ever taken. It's the greatest supplement ever. And I'm like, actually, I've been taking L-glutamine. I love it for gut. I love it for, you know, the healing process, et cetera. And then they started alluding to the fact that they began to sleep 90 more minutes a night during the time where they took L-glutamine. So then I'm suddenly like, well, wait a second, is it the glutamine or is it the sleep?
Yeah.
We're seeing this a lot, even with concussions now. How are we going to find these answers out? What do you feel like we need to do? And I'm asking you, like, what do you think we need to do to evolve and to gain more information on that category?
I mean, I think the answers to those questions may very well not ever come to fruition, because there's so many confounding variables, right? You're talking about different human beings. We're all different. So like we've talked about, what works for you may not work for me. So I think that you've got different people with different protocols, different physiologies. I think that you can make general statements, but to make a blanket statement that like L-glutamine is the best for everyone, right? I don't take L-glutamine. I sleep really well. I feel like I'm super healthy. I eat right. I sleep right. I work out. So maybe it's not the best thing for me.
Right.
I don't think we're going to have an answer to everything. I think that it is important for people to support research. I feel like that's the only way that we advance anything that we do as a species, whether it's brain surgery or whether it's nutrition, it's only going to come about through research. But I don't think research is going to answer every single question, because a lot of those questions are simply unanswerable. And I would say there isn't even one answer. There's multiple answers depending on who you ask. My only suggestion would be that when you go for advice, and I tell all my patients this, look, get as many opinions as you feel necessary to feel comfortable, but make sure it's coming from an expert, right? Because if someone wants to know about the benefits of L-glutamine, asking you is obviously the right way to go. You're an expert. You at least have an excellent knowledge base in nutrition. Whereas, oh, you're going to ask the guy down the street about L-glutamine, and he may have an opinion because he read some Google blog, but that's not real knowledge. So I always say that make sure that whoever you're talking to when you're trying to get advice on anything dealing with ways to improve your lifestyle, talk to at least someone who's credible and is an expert in the field, because you want that expertise.
I can see how it gets confusing though, right, Derek? I mean, there's so many, I mean, even from a fitness standpoint, I mean, you'll have a million different people posting a million different things, and yeah, they probably all do work, but you can see now how the general pop is really, well, there's a lot of information out there. I don't know what to listen to. Is keto great? Is, you know, is the Mediterranean diet the best? It's like, there's so many. And at the end of the day, I just see the people who are great with this, they come back to this umbrella policy that you're talking about. It's like the main things have to be, you know, in check 90% of the time. We're going to have our bad nights of sleep. It's going to happen. We're going to travel. We may have a couple cocktails here and there. You're going to go eat some ice cream or have some pizza. But for the majority of the time, we need these things in a good place, and we can't abuse something that some people enjoy way too much.
I mean, I also want to say, I feel like a lot of the problem comes around with social media and the internet. You know, it used to be that, you know, and I'm going to use the word morons, but morons didn't have a platform.
Right.
Now, everyone has a platform on social media. So someone can be a legitimate moron and start posting about nutrition and fitness, and you're going to find other morons that believe them, and they're going to start following what they do,
Right.
even though they have no credibility. And so I think in the era of social media and the internet, I mean, I can't tell you how many patients come to my office. Oh, doc, I read this on the internet. And what do you think about this? And it's like the craziest thing I've ever heard, like has nothing to do with anything of how brain tumors are treated. And they're like, but I read this. And literally, you don't even know who's writing that. And the same thing goes for like fitness and nutrition. So, you know, I just caution people that in the era of social media and the internet, wherever you get your information, just be cautious of the source and make sure it's credible.
Okay.
In your field, are there any fantastic innovations that you see now or coming? Like I was, you know, I get some medical feeds, and they're showing a guy doing like a knee replacement with a robot from 2,000 miles away. And then I saw another one about glioblastomas, and they do injections in mice, and it just gets rid of the tumor. I don't know what the injection is, but is there stuff like that on your radar?
So, you know, I think the coolest thing that's going to happen in neurosurgery in the next 5-10 years, it's not something I do, but my colleagues do it, is the whole brain machine interface. So the ability that with your brain to control a machine, and there's various different applications. Number one, people that had strokes, or people who lost their arm, amputation in combat or what have you, they're now developing protocols where they can put a prosthetic arm on, and through different technology, when the person thinks about moving their hand, the prosthetic moves. I mean, it's wild. They can somehow harness the EEG, like the electrical activity from the brain, so that you think, just like you're thinking now, you and I think to move your hand, and your fingers, senses go through the neurons and your fingers move. The ability of connecting the brain to a machine to move a prosthetic, so that people who have lost a limb can regain that limb. That's
game changing.
Like spinal cord injuries too? I assume that would be with spinal cord injuries too. I assume.
Absolutely. This is the new field. It's called functional neurosurgery. Again, I don't do it. I can't get too into the discussion, but my colleagues do it. And I I see what the research is evolving, and it's fascinating. And the other thing would be, you know, a lot of the neuro wearables now, like they're developing ways where there's headbands that can read your EEGs, such that instead of like changing the remote on your TV, you're wearing this headband and you're like, I kind of want Sports Center, and it changes the TV to Sports Center. Like, so I think we're getting into an era where the brain, which used to be a black box, we're kind of harnessing the brain and the thoughts and how it works, such that you can essentially connect your brain to a computer, and that's the interface, which is why it's called the brain machine interface. It's unreal.
It's why I'm hearing about nearables now, where like you can just step in front of a mirror and it could tell you your temperature. It can just, it's able to detect all these things going on inside of you.
Mhm.
I think discussing about robotics, did you see recently how there was someone who was, they were paraplegic. I think they were like in a chair, couldn't move, and then they got into a specific suit that was designed for them, where they're able now.
Exoskeleton, or
Yeah, it was unbelievable. But you taking someone who's been in their chair out of the
Mhm.
chair, they're able to look eye to eye with someone and have them move around. Oh
Yeah, I
my
mean,
God.
that's the
It's
brain
fascinating.
machine interface. So
Yeah.
so they basically put on this exoskeleton, which is cool, but that's not the coolest part. The cool part is connecting the exoskeleton to your brain.
Oh, see, I didn't know. So you're talking about the same thing that I'm talking about right now. I
It's,
thought,
I mean, it's similar but different. So they have it for all types of limbs. They have it people who have lost their hand, lost their arm, and for people who have spinal cord injury who can't walk, they're starting to develop these exoskeletons that will go on your legs, and the patient has to think, I want my right leg to move forward. And just by that thought, the exoskeleton moves and does a step. So now you're training that patient to walk
right.
by thinking like we all do to walk, but through the exoskeleton. Again, mind blowing.
Dr. Komotar, I have a question for you. Because you've obviously been practicing for a decade now. You've been performing surgeries for 10 years, 7,000 surgeries. Is this, what's next for you? Because but being in your field, it's not, you're not a dentist here. No, no disrespect to people in the dental field. Like, this is highly complex. You don't really get to meet a lot of neurosurgeons. But is this just, I'm going to keep doing what I'm doing and I just love it? Is there something, you're working with different organizations. You mentioned the Dolphins. Is there something else that you're trying to eventually evolve into?
I don't think there's anything that I'm trying to evolve into. I think that one of the reasons why I think I have the best job in the world is that academic neurosurgery, and by that I mean brain surgery that's done at a university setting, it's there is no status quo. No matter what you're doing, there's always ways to improve. I'm
Right.
always teaching medical students, training interns, training residents, training fellows. So even in the 10 years that I've been here, the field has, the way that I'm operating now is totally different than the way I was operating 10 years ago. And like I said at the beginning, we know so little about the brain, right? Like the heart, we know it's a muscle, it's got 4 chambers, it's got valves. Like, there's not that much more to learn about the heart or the bones or the kidneys. The brain, we literally know like 2% of what the brain can do. And so there's always a challenge, right? You can always do a surgery better. And I tell my residents and fellows, no matter how good a surgery goes, think to yourself, how can I do it better? Because the moment you say this is good enough, it's not good enough and you're going to fall behind and people are going to pass you. So you always have to be looking how to improve. I think research in neurosurgery is so promising, and I think that the field is so early in its development still that there's always a challenge. And I think just like you guys, I thrive off of challenges, and I think that that's something that makes my job great, is that those challenges never run out. I'm young, Don, you and I are the same age. I'm also 46. That's the best year. 77.
77.
77, right?
Yeah, what month?
February 3rd, 77.
It's April 15th, tax day.
There you go. Perfect. But 77, I mean, 46 is still young. And I feel like the challenges never end in neurosurgery, especially in academia. And that's why it's the best job. So where do I see myself? I see myself continually pushing the field forward.
I love it.
I see myself training, the next generation of leaders in the field, which is best part of my job.
I love it. T, let's wrap it.
I got one more question, quick one. Do you ever get tired of saying, come on, people, this isn't brain surgery?
So I actually never use that because I feel like it's
That's
it's
a
super
bad
corny.
dad joke right there.
It's super corny, so I never say it. However, I get told that all the time, and it is kind of funny. But yeah, I personally never say it.
Okay.
So
All right. Well, Dr. Komotar, where can everyone find you? I know you are active on social media.
yeah. So my Instagram account, which is just at Ricardo Komotar. So it's RICARDO KOMOTAR. And then Don's been on my podcast, which is thecrossoverpod.com. Yeah, check it out. Give me a look.
Well, listen, we were honored to have you here. Thank you so much. And it's been great getting to know you, man. When are you out in New York? I want to have you by. We'll get a workout in.
I got family in New York, man. I'll definitely come up. Where are you in New York?
I'm in Long Island. I don't know if you got family close to Long Island. Where are you?
No, still in Northern Jersey, but dude, I'll definitely look you up. I'm going to be there in June.
Dude, hit me up. I'll be here. I'm here all of June, except the first weekend. I'm going to be here the entire month. So let's get a workout in. We'll get some food. It'll be good to
I love it, man. Sounds good, guys. Thank you so much for your time.
Thanks,
Thank
brother.
you.
All right, guys.
Take care. Bye, guys.